Vasant Nagvekar, physician and infectious disease consultant at Lilavati Hospital. My association with Lilavati Hospital has been since 2005, and my main area of interest has been in the infectious diseases. So what is infectious diseases? Infectious diseases relates to infections not only in community, it also deals with hospital acquired infections. It deals with people with not having comorbidities and people having comorbidities. My main area of interest in infectious disease is treating immunocompromised patients, that means transplants, infections, patients who have got infections due to chemotherapy, or patients having infection due to hematological disorders, and also infections in the ICU. It's a very challenging branch, as history taking and going into absolute details into the patients is what gives us the diagnosis. It also deals with a lot of these tropical fevers, tropical infections. It deals with community acquired fevers. It deals with fevers of unknown origin. There are people who have undiagnosed fever, and there my expertise come into picture, where we try to get too close to the diagnosis of fevers of unknown origin. That means fevers which are not solved on a routine basis. Also, my expertise comes into tropical fevers. It comes into vaccinations, adult vaccination, infection control practices, and also into the microbiology department. Because infectious disease and microbiology department goes very close hand to hand. And so my main expertise is basically in dealing with what would be the right choice of antibiotic for that person, and whether that antibiotic would work correctly for that patient or not, and whether it will reach that site. So choosing an antibiotic, antifungal, antimicrobial, antiviral, coming to a close diagnosis of a patient of infection where fevers are not subsided, sepsis, septic shock, all this expertise will come into infectious disease. It's a challenging branch, and we try to get as much as possible. Coming to community acquired fevers, a lot of these dengue fevers, malaria, leptospirosis, chikungunyas, typhoid fevers, all also are a part and parcel of infectious disease, apart from hospital acquired infection.